Oh, is it going? Welcome back to another video here. My name is Brad. I'm a student physical therapy assistant. I have my wonderful model Keyshawn here with us. Thank you for being here. Today we're going to be doing manual muscle testing of the hip and all the different motions of that hip. The first one on this right leg here, we're going to start with internal rotation. And so for internal rotation, his leg is going to be going outside because his hip is going to be internally rotating. So if you can internally rotate your leg for me, perfect. I'm going to test if that's the end feel there, which it is, perfect. Then I'll have him come back down. Then next I'm going to have him go about right here. Hold that test position for 3 seconds. 1, 2, 3. Perfect. He's able to do that. All right. And then the final test here, I'm going to have him hold that test position again. And then I'm going to try to push it in and then just resist my pressure. So on the count of 3, 1, 2, 3. All right. 1, 2, 3. 1, 2, 3. Oh. So he gave a little bit at the end there, but he was able to hold against gravity, hold the test position, and full range of motion. So I'd give him a 4+ for this one. And then he held against a moderate to max pressure, which would give that 4+. Next, we're doing external rotation. So his foot's going to be coming inside here. And then I'm just going to test full range. Perfect. Then have him relax. And then I'll do it one more time. Hold that test position. 1, 2, 3. Perfect. And the next, I'm going to put him in that position again, and then I'm just going to have him resist my pressure one more time, and I'm going to be this way. So on the count of 3, 1, 2, 3, 1, 2, 3, and 1, 2, 3. Oh, perfect. All right, just because he held against gravity, held that test position and full range of motion, gave a little bit at the end there again, I'd give that a 4+ because it was moderate to max pressure. All right, next we're going to be moving to the flexion of the hip here. And so he's just going to be lifting his knee as high as possible to his chest. Perfect. He was able to do that. Then I'll just have him rest again. And then I'll lift it back up and I'll have him hold that test position for 3 seconds. 1, 2, 3. Perfect. All right, and then I'll have him hold this right here, and then I'm going to put pressure on again, and then just hold resist against my pressure. Excuse me. All right, on the count of 3, 1, 2, 3, 1, 2, 3. Okay, so I'd give him. He held about min to moderate pressure there. He held the test position, had full range of motion. I would give him a 4- for that one. All right, next we're going to test extension. So Key, if you can lay down prone for me on your stomach. All right, thank you. And so with his left leg here, he's just going to be lifting it as high as he can. So if you can lift your left leg for me, keep it straight there. Perfect, and then you can relax. All right, and then I'm going to have you do it again and hold this test position here for 3 seconds. 1, 2, 3. Perfect. All right, and then I'm going to have him hold this here one more time and then resist against my pressure. All right, on the count of 3, I'm going to push. 1, 2, 3. 1, 2, 3. Oh, perfect. So he held about moderate pressure there. I'd give him another 4- for that one. And then
minus, you mean?
Yeah.
Mod pressure.
Oh, moderate pressure. I'd give him a 4.
Great.
Excuse me. I give him a 4 for moderate pressure. Moderate to max, 4-. All right, and then as you can tell as well, I was pushing from the distal end of his tibia here. If there's a knee injury, I would push from his knee, right above his knee. All right, so we got done with extension. Next, we're going to do abduction. And so abduction is, can you lay on your side for me? And then that bottom leg, he can kind of fold a little bit like that. And so we're just focusing on his right leg here. Are you in a comfortable position, Key?
Yep.
Cool. All right, so he's just going to lift his leg and abduct it as much as he can. And perfect. So I'm just going to make sure that he's kind of in extension here a little bit. Perfect. He's able to do that. And then next, I'm going to have him do it again. And then I'm going to have him hold that test position for 3 seconds. All right. 1, 2, 3. Perfect. All right, and just relax. And then one more time, and then he's going to resist against my pressure. So I'm going to have him hold here, make sure that it's extended a little bit or neutral. All right, I'm going to push on the count of 3, resist my pressure. 1, 2, 3. 1, 2, 3. And 1, 2, 3. Perfect. So that was about mod to max pressure there. So I would give him a 4- for that one.
Mod to max.
A 4, excuse me.
Mod to max.
4 plus. Yes. It'll be a 4 plus for that one. All right, and then the last motion we're going to be looking at here that we're going to be testing would be his Adduction. And so with that one, can you cross this leg up here and then extend this leg? Perfect. And so this is the testing position for testing Adduction. All right, and so I'm just going to have him with his bottom leg here. Can you lift it up as much as you can? Pretty good range of motion. I'm going to test that full range, which it is. Perfect. You can relax. And then next, I'm going to have him hold that test position about right here. All right, hold for 3. 1, 2, 3. All right. And then I'm going to have him go up in that test position one more time, and then he's going to resist my pressure. All right, on the count of 3, key. All right, 1, 2, 3. 1, 2, 3. 1, 2, 3. Perfect. So he resisted really good there, max pressure. So I'd give him a 5 for that Adduction. And that is manual muscle testing for the hip.